Welcome back to the Ed Morrissey Show podcast. It's my pleasure to introduce to you Dr. Marion Mass. She's a practicing pediatrician, co-founder of Practicing Physicians of America, and leadership in Free to Care. And Dr. Mass, thank you so much for joining us today.
Oh, thank you for calling me and having me.
Well, you wrote a very interesting op-ed. This may have been like a week or so ago in the Daily Caller, talking about ending policies that drive up healthcare costs. And among those policies, and you're speaking directly to my antitrust heart here, ending consolidations in the healthcare field. And I'm one of those unusual conservatives that happen to think that consolidating more and more economic power into fewer and fewer hands is a bad practice. But most of my fellow conservatives are not along with me on this. But this has real world consequences, and especially in healthcare, where you've also got government encroaching at the same time, Dr. Mass.
Oh, 100%. And, if you want to take us back to an amazing quote that I think demonstrates this, I just kind of bumbled upon it today. I just tweeted it out too, in response to someone. So this comes from the great Milton Friedman, and wasn't he a smart cookie? I do not believe it's proper to put the situation as industrialists versus government. On the contrary, one of the reasons I'm in favor of less government is because when you have more government, industrialists take it over, and the two together form a coalition against the ordinary worker and the ordinary consumer. I think business is a wonderful institution, provided it has face-to-face competition in the marketplace, and it can't get away with something except by producing a better product at lower cost.
Right.
Do we just say it all right there in healthcare? We've been paying more and we've been getting less.
Not just in healthcare either. I mean, my first real grown-up job was in the defense industry. Back when you had, even when I was there, and consolidations had already started happening at that point, but you'd have maybe 6 or 10 different companies that could be prime contractors on defense contracts, defense and aerospace. And now you're down to 2 or 3 because they bought everything up. My father worked in the space program for 30 years, right? And he gets his pension from a company he never worked for. He gets his pension from Boeing. He's never worked for Boeing a day in his life. And he's continuously amused by this, that Boeing is paying him his pension. But this is really, I think, even more acute in the healthcare industry, Dr. Mass. And you lay out a lot of this argument in this Daily Caller op-ed. And again, if you want to find this, and I'll have the link up in the podcast post, it's time to end policies driving higher healthcare costs. You walk through several consolidations that are really just in the last few years. We're not even talking about, this is a 40-year trend. This is accelerating these days, in large part, I think, because of government pressure and compliance costs.
Oh, well, we could say government pressure. Different reasons for different industries. All right. So let's take the main thing that I talk about in this is the hospital industry, and not even just hospital, but hospital and physician. Because if you look at what has happened to physicians over the last 20 or 30 years, I believe about 20 years ago, a third of physicians were not independent, were owned by corporations or owned by a hospital. Now 70% of us are owned. I mean, I mean you get your paycheck through the hospital. And the hospitals themselves have become giant, large conglomerates. And in many ways, I remember COVID came along, and of course we need hospitals, right? We definitely need hospitals, but they're certainly sucking a lot of money out of the healthcare economy. I mean, if you take a look, Free to Care wrote a position paper, and if you look on our Free, the number 2, and then Care website, you can see report. And then if you go underneath that report, the very first thing we show are 2 graphs. And the one graph shows that if you take the healthcare pie and divide it, and you take all the payers. Now, this, of course, leaves insurance out, but if you take all the payers and you look at what they're paying, your hospital is your largest portion of the pie, but there's another giant portion of the pie that is doctors and clinics. And now that hospitals own a gigantic portion of doctors and clinics, hospitals, it's where a lot of the money is flowing into. And one of the big arguments over the last several years has been, do we enforce some sort of transparency? And, I realize that, conservatives and libertarians don't like things forced, but I don't know how else we do it because the hospital industry has grown so big. Just the other day, I tweeted out, and it gets back to the Milton Friedman quote. If you look at the top 10 lobby organizations, or the top 10 groups that lobby in America, the American Hospital is right up there. And, if you're big and you're collecting money, just like Milton Friedman said, you can go and you can lobby and you can say, well, no, we have good reasons to keep our prices secret here. It's been a giant battle. When we go back to the Daily Caller piece, it talks about the fact that a lot of regulation caused hospitals to buy up practices because it was economically advantageous for them. Most Americans don't realize that all of the Medicare money that goes out, a hospital gets more.
Right.
If they own a physician practice. Yes. A hospital will get paid more than an individual physician practice. So it incentivizes the hospital to buy up the doctor. And doctors kind of close to the end of their career. I mean, one of the things that they might decide to do is, okay, well, I'll sell out my practice, and then practice gets taken over by a hospital. And if once that takeover happens, 1 week you could have your procedure costing X, and then now you get the added bonus because you get owned by the hospital. That's crazy. I mean, nothing may have changed.
Yeah, Dr. Mass, I was talking to Dr. Richard Kuby about this about 4 months ago, and he was talking about the two-tier payment system in Medicare and how that is incentivizing this. So it's not always, government pressure in the form of regulatory pressure, but sometimes it's in the form of financial incentives. And this is one of the big financial incentives. And I think, if I remember correctly, that he said it was a 26% increase in payments from Medicare to hospital-owned practices as opposed to privately owned practices, and for no other reason other than it happens to be owned by the hospital. So it ends up being financially beneficial for people to sell their practices to the hospital because everybody gets more benefit from Medicare. And this is just Medicare, not the other, not private insurers. But Medicare is a huge financial incentive for healthcare providers, especially these days, as more and more Americans are, as we're getting older. Now, I would imagine as a pediatrician, you probably don't have quite as much pressure because your patients probably aren't in that position. But in general, though, I mean, that's one of the big issues that's driving this. And Dr. Kuby was talking about that with us about, like I said, 4 months ago. And so I see exactly what it is that you're talking about. It's a real problem, and it's not making things more efficient. It's actually making things more costly. The same procedures are more expensive because of it.
Sure. And now the hospital is perversely incentivized to want to do more procedures, or they're perversely incentivized to kind of encourage their, owned physicians to perform more procedures. And, actually, if you start getting back, and I know it was one of the big arguments with Obamacare, everyone talked about, oh my gosh, the awful death panels and so on and so forth. But when you get to end of life, one of the things that I find very sad, I've lost both my parents. I was actually there for the last breath of each, and we willfully chose, hospice and to not do a lot of extraordinary care. But I remember so clearly, a friend asked me to come and speak to her father's physician after I lost my father, and she was very apologetic about the whole thing. But the bottom line, it was because a hospital employed physician that was pushing for dialysis, and her mother had very clearly stated, he doesn't want this. He wants to come home. He wants to be done. And she was getting pushed and pushed hard. And so now if you look at the life of a physician that's owned by a hospital, maybe you're getting pushed to want to do more procedures, to want to extend a life instead of doing really a good and kind thing for your patient, or to do less in the way of procedure or less in the way of what's what's pulling the dollar into the hospital. So one of the ideas behind this piece that we wrote, or one of the main points of the piece, was we should have site neutral payments, because when you have a hospital incentivized because they get more money from Medicare for doing procedures, the hospital is going to be incentivized to do more procedures. And we want to be able to trust our hospitals. I'm not saying that every hospital is doing it, but we want to be able to trust our hospitals and know that the care that we're getting is the appropriate care, the needed care. And when you can't do that, it sets up a nasty situation for the patient.
Well, it does. And, you know, I believe in incentives, right? So I'm a kind of a Milton Friedman guy anyway. I'm a Milton Friedman, you know, F.A. Hayek kind of guy. Where the incentives are is where the behavior is going to go. And doesn't even have to be really a conscious effort. It's just that, oh, they're paying us to do these procedures. We should go ahead and feel more comfortable doing these procedures, et cetera, et cetera. It's not, you don't have to assign a malign purpose to that, but that's just the way human beings are. They respond to incentives. And you talk about incentives in different contexts in your op-ed piece here. You're talking about healthcare consolidation. And I think the first example that you give is North Carolina's Mission Health System that was acquired by HCA Healthcare. In that consolidation, it bought up 7 of the region's largest hospitals and 124 physician practices. Now, maybe that's an efficiency thing, right? But the issue becomes, and this is another set of incentives in consolidations, is are you really getting a variety of options when you're looking for healthcare? Or are you just really getting 124 flavors of the same thing now because they are all owned by the same company?
Oh, 100%. So what you're talking about is choice.
Right.
So when you have no choice, it's all HCA. And by the way, like, you know, think about that, like 7 hospitals, 100. I mean, I forget how many hospitals HCA owns. And HCA is a for-profit hospital system, but, you know, they too certainly, you know, sucked away a lot of government help. It was astounding. I believe they took in $6 billion during the money to keep everything going during the pandemic. I know they pledged to give back the $6 billion. I don't know if they did, but it's hard to know. And like,
you think anybody's asking?
I don't know, but man, I found it fascinating because one of the very little known facts about HCA, you're going to learn about an industry very few people know about. I mean, and I bet my bottom dollar you've heard of PBMs, pharmacy benefit managers, right?
Oh, yes, yeah, absolutely, yes.
Yeah, I could talk all day about those dudes, but I mean, we won't. I'll try to keep myself back. But one of the little known facts to Americans, so they've learned that like PBMs are the middlemen for their prescription pharmaceuticals, but hospitals have their own set of middlemen called GPOs, group purchasing organizations. Fascinating thing about PBMs and GPOs, and it goes back to where I said that, like, you know, I think I said this on this podcast already, but the government will often give certain benefits to certain large corporations. And we're going to have to edit this part out. I'm about to cough. I'm sorry. Or maybe you can keep it in and keep it real, because, you know,
it's fine. We'll keep it in. We'll keep it in. We'll keep it real. It's not a problem. So yeah, the PBMs and the GPOs benefit.
They were given, yeah.
Yeah.
Well, they were given an incredible government benefit. Congress, you know, gave it to them in a bill in '87 for the GPOs, the purchasing organizations. They control all the flow of all of the products into the hospitals. They gave them the right to accept legalized kickbacks and not get prosecuted. Astounding. I mean, imagine if you had the right to receive kickbacks. It gets back to our Milton Friedman quote. You know, what you really have is you have you have like a great relationship between a corporation that's not so little and the government, and then the little guys left in the dust. And then in 2003, the government gave the PBMs the right to receive kickbacks. These corporations are the only ones that I know that have the right to accept legalized kickbacks. Now I'm going to get back to why I talked about HCA. They own one of the largest GPOs in the country. So what do you think happened during the pandemic? I mean, and I got it early on, you know, people are a little anxious. You have to check, you know, COVID testing, all that other stuff, but they were perversely incentivized to test. And, the other thing that I'll point out is one of our, big COVID cures, so to call, that remdesivir drug that was owned by Gilead.
Yes.
That drug has to be given in a hospital. So all the tests that are getting into hospitals and the drug remdesivir that's getting into hospitals and all of the products needed, because remdesivir is an IV drug, like the IV tubing and all that other stuff,
Sure.
all that stuff gets into the hospitals via contracts that these GPOs write. And the GPOs are selecting which products get into the hospitals. And HCA owns a big GPO, and the GPOs can accept money from all of the manufacturers. So essentially, the manufacturers pay to get their product into the market because they can accept kickbacks. And then they're perverse. Yes, it's absolutely ridiculous. And then if you look at what happened to HCA, I mean, hospitals were losing money. HCA was like, cha-ching, cha-ching, cha-ching. And like, you can't see it because no one's allowed to see the secret kickback contracts other than HHS OIG. And apparently they've never asked. But one wonders, how much money did HCA's group purchasing organization make during the pandemic? And I mean, I guess you can only say that they were perversely incentivized to choose products that were given in hospital or to choose to do more testing. But the perverse incentive lies there. And then the real problem with the perverse incentive is, who's going to trust the hospital if they have this perverse incentive to do more, pick products that might not be the best thing, but
right.
It's just the best thing that money can buy? Terrible.
Well, in the case of HCA, and again, it's just sticking with this because it's a great example of what you're talking about here. It's not even really an issue now of whether you can trust HCA. They control 90% of the hospitals in the region in which they operate. You don't have any other choice in a lot of cases other than to trust HCA. And I'm sure HCA is doing fine work. I'm not trying to impugn their work or their motives. But what I'm saying is that when you have somebody owning 90% of a market because of consolidation, that is a failure to enforce antitrust laws. And it's 100%. A failure. It's a failure on the part of both Democrats and Republicans, really, because Democrats love to see consolidation in the healthcare industry because they want to eventually consolidate it under complete government control. And this is part of the process of getting to that point. And Republicans don't like to interfere with mergers and acquisitions for reasons. And again, I'm always mystified by this because they're the same ones that say, well, we want smaller government. We don't want large government. And it's like, well, if you don't want large government, you probably don't want large big business either, especially in really critical areas like healthcare or like communications. And maybe this issue here, the healthcare consolidations, will shake some of that loose. Now, you also talk in your piece. Again, we're speaking with Dr. Marion Mass at Daily Caller about a bill that the House overwhelmingly passed called the Lower Cost, More Transparency Act. Tell us a little bit about that. Is this a first step to addressing the incentives, or do you think it's also a first step to addressing the problem of acquisitions and consolidation?
It helps. I mean, the point that I was trying to really point out in the piece was that this neutral issue, that this bill prevents hospitals from collecting a higher fee for their Medicare patients.
Right.
So it takes away the perverse incentive. So then hopefully it prevents some of the incentive for the hospitals to want to buy up physician practices. So it certainly helps. One of the other things that the bill does is it codifies, so it puts it into law, the Trump transparency executive order that came out, I forget which year it was, but like that pushes for hospitals and insurance companies to have to make their prices transparent and machine readable. In other words, like if you said it simply, like the patient would be able to see an EOB, like explanation of benefits that happen between hospital and insurance company and some testing companies and things like that. They would be able to see an EOB before they got the bill. before that, it was a great big mystery. Patients would ask, well, how much is it going to cost this hospital? I don't know. Call the hospital. The hospital would say, I'm not sure. And then all of a sudden you get like, surprise, my goodness, this cost way more than we thought it would. So
Right.
it helps with that particular vein of transparency. There were some other efforts in the bill to put a little bit more transparency on those pharmacy benefit managers that you and I brought up. That got watered down. The first iteration of this bill was really good. It was done out of Energy and Commerce, and then there were big fights, and Ways and Means put out their own bill, and they really watered down the sections on insurance transparency and also transparency of ownership. The original Energy and Commerce bill wanted to point out that private equity was buying up a lot of physician practices, and they just wanted a report to go out to make that obvious. For some reason, Ways and Means decided they didn't want that, and then there was a big fight and so on and so forth. First bill out of Energy and Commerce was far superior, but that's why what you said, this is a bit of a first step. So you're codifying the transparency, and you're making things a little more transparent for the PBMs, although that really got watered down, like I said. And then the other thing is making things site neutral. That was a big step. But, regardless of what you do in Congress, they pass it, and then HHS has so much power. I don't know if people realize this, but one of the problems with the Affordable Care Act was it put so much power in the hands of the head of HHS.
Yes.
And if you dial back to when 2017 happened and the Republicans had the House, the Senate, and the presidency, I mean, if there was a time to repeal the ACA, you would have thought it was then. So, I mean, I don't even really, I think saying repeal the ACA, you're just starting a food fight. Like when you say it, it's like, it's a slogan. It's a bumper sticker. I mean,
it turned out
better.
to be.
Yes, because if they didn't do it then, one of their arguments against doing it, like behind the scenes, was, well, we want our HHS dude to have, some regulatory power, so he does the right things, So, I could see a point to that though later, because it certainly was under HHS, and I think Alex Azar was an excellent HHS secretary. People can complain and moan all they want that he came from pharma and all that kind of stuff, but Azar really did a lot with transparency, and he did a lot with pharmacy benefit manager regulation. Well, deregulation, I would say, deregulating to the point where those kickbacks that they get to accept, he was passing them on to the patient, which is the best you could do with the HHS level. But so anyway, point being that no matter what you do in Congress, you still got to watch out, because the departments, these regulatory departments, will come around and do something completely different. A couple of years ago, there was a big battle on surprise medical billing, and pretty much HHS Secretary Bixera just ignored what the congressional intent was. I mean, he had a couple hundred congressmen from across the aisle send him a little nasty-gram and said, why did you just ignore us? Like you did what you wanted. You wrote it into your own rules. I mean, what's the purpose of lawmaking if you have the executive branch come along and just change the law that you made?
Yeah, I was trying to raise the flag on, I think it was something like 400 or so iterations of the Secretary shall determine in the ACA when it was still being voted on in Congress.
Yes.
There's hundreds of those in there. It's basically a complete power shift from Congress to the agency. And the reason why Becerra can get away with that is because the ACA was written so they could. In order to get Congress to take control of this, they're going to have to repeal the ACA at some point, or at least heavily amend it so it removes all of those. The Secretary shall determine. That to me is part of another entirely different topic, related but entirely different topic of the growth. I would call it the malignant growth of agency law in the federal government, because Congress doesn't do anything anymore, really, in terms of writing laws. They just simply pass the buck to the agencies. This was one of the biggest buck-passing exercises by Congress, probably since Woodrow Wilson. And people didn't really understand it at the time. And it doesn't surprise me, Dr. Mass, that you were hearing from people that, well, we don't want to repeal it because we want our guy to have that power. That's the problem.
Yes. Yes.
The problem.
It's very hard to give up power. I don't know what it is.
Yes.
Like
Another incentive.
My youngest is 20. I'm like, I'm happy for them. Get all the power you want. Like, I want you to be successful. Do your own thing. I think the mark of a good leader is to let the people under you be able to figure it out. But I had written a piece in 2017 for the Philadelphia Inquirer, The Fatal Flaw of the ACA, Coverage is Not Care. And if you go in and you read the hyperlinks on the piece, even at that time in 2017, and keep in mind, I really think most of the stuff that came out with the ACA was passed in 2010, but most of it didn't start to happen until I think about 2014, right? Which of course one could ask.
2013, I think it was fall of 2013.
Could have been 2013. Okay, fair. Yeah, you're aware, you're on top of it. But it's very interesting. The first question should be, well, if this is all so important, why are you putting it off? And we all know why, because they didn't want their guy to look bad. And then
because they wanted to get past the next presidential election. That was what it was. They wanted to get past the next presidential
100%.
election. And as soon as we were past the next presidential election, then it all kicked into gear.
Yes, but it was even at that time. So 2013 fall to when I wrote this in the maybe February of 2017, there had already been 11,000 pages of regulation written by HHS based on the ACA. There's probably tens of thousands more by now, but you can't put that much power into like a regulatory body like that. It's a mess. And actually, I think that whole little line there, coverage is not care. I mean, people have just taken those two things to be synonymous, that healthcare means I have coverage, that someone's going to cover it, that someone's going to pay for it. Well, guess what? When someone is paying for something, there's ways that you can manipulate and move the levers to make that something more expensive so that people are making a lot of money. And predictably, since the ACA was passed, hospitals got richer, pharma got richer, insurance sure as heck got richer, PBMs got richer, those GPOs that I mentioned, those purchasing organizations got richer. Generally, Americans got poorer in terms of healthcare. And, right. I mean, and actually I'll say, I think overall, I'm giving out the little shout out to my own profession here. And I'm not saying that every doctor is got a halo around them. Me, maybe, but not all, right? Okay.
I'm willing to stipulate to that. There you go. I'll stipulate to that.
Well, I'm say the uncomfortable things that most people don't want to say, right? I do it for free. I'm not, I'm not get paid to be on your show, and I don't care, because I'd rather see my children and my children's children have a better future. But, if you look at the Medicare physician fee schedule, we keep getting cut. Everyone else is getting raises and we get cut. There's a graph that I put up the other day on Twitter. You have to go through my tweets and my replies and stuff. But we're sort of flat. And if you consider the cost of running a business, we're way below that. So we're actually taking a cut, and they're going to give us, or they actually did give us another cut starting in January. And people are trying to put a stop to it. And, then the media pumps out the stories, those horrible, rich, awful doctors and blah, blah, blah. And look, I mean, most of America is suffering, I think, currently economically in an epic way. But I have met many a physician that's left medicine because they're like, dude, it's just not worth it. I was just stitching up a kid the other day, and the father was an oncologist, and he's like, yeah, I practiced for 4 or 5 years and then I left for pharmaceutical. I really I couldn't pay back my loans. I'm much happier. I don't take call at night, all the rest. I mean, I don't think we want to keep on doing this to our physicians, because all those corporations are not going to be there in the middle of the night at the hospital when you need them.
That's right. That's right. It's absolutely correct. And that's what
I'm not saying pay us more. I'm just saying don't pay us less. It's a bad idea.
Well, how about just reset the incentives to incentivize people entering the industry, incentivize practices to flourish, incentivize patients to have full price transparency with their physicians and with their hospitals. I mean, we can start with just don't let other hospitals buy each other out till you only got one operator. for an entire region. That would be, I think, something that Congress and the executive branch could do. We're out of time. Dr. Marion Mass, do you have a website that people can go to that they can read more about the work that you're doing?
You know, the place I'd refer you to is Free to Care, free the number 2 and care, because I think that website was set up for the general public to understand. And for people that are really gung-ho and want a little more, they can go underneath the tab that says report, and they can read our position paper that talks about a lot of these things. And yes, I realize it's 97 pages, but a lot of it is annotation. And if you don't complain to me, because if you want to think about how long it takes to read, you don't even want to know how long it takes to write. But I bet you could break it down, and I'm told it reads pretty well. But you can go to that Free to Care, and you can see our report, and you can follow me on Twitter. I guess you could look me up on Muckrack, because I've been writing since 2017. I'm willing to take it all on. Those nasty PBM middlemen. I've taken on the AARP, I have myself a good time.
Good. So. Well, I kind of like the idea of a pediatrician taking on the AARP, just in terms of symmetry. I kind of like that. I kind of like that whole idea there, Dr. Mass. By the way, the website is free, the number 2, and then care.org, free2care.org. Dr. Mass, thank you so much for spending some time with us today.
Oh, I'll be happy to come back more and tell you about all the people that have called me a conspiracy theorist and all the big lobbyists that try to take me down. And it's great fun. Good time.
Sounds like it. Well, we'll get you back then to talk more about that too.